Let's get analysis now. The South African Health Products Regulatory Authority said in a statement that it is concerned that use of the Sputnik V vaccine in South Africa, a setting of a high HIV prevalence and incidence, may increase the risk of vaccinated males acquiring HIV. For more on this, Dr. Angelique Coetzee, who is the chairperson for the South African Medical Association, joins us via Zoom. Dr. Coetzee, thank you so much for your time and good afternoon to you.
Good afternoon, and a good afternoon to all the viewers out there.
Now, Dr. Coetzee, as SAHPRA, what are your views on the use of Sputnik vaccine in South Africa? Because, I mean, we've heard already from SAHPRA saying that they have looked at this particular query at length and they are satisfied with their current decision.
Well, SAHPRA at this stage will support SAHPRA. SAHPRA did look at all these studies. There were 2 studies that they looked at. And again, if you look at those studies, the conclusion that SAHPRA came to was that if you use this Sputnik vaccine, you are setting the setting of a high prevalence, because we have a high prevalence of HIV, and we might then increase the risks of vaccinated males acquiring HIV. South Africa is known to have one of the highest HIV populations in the world. So we cannot accept this. It's not safe. You know, one of the things that is important is the safety around these vaccines. On the other hand, for now, we have more than enough vaccines. So we have enough Johnson & Johnson as well as Pfizer vaccine. So we don't need another vaccine coming into the country. So this become actually a moot discussion at the end of the day, as, we cannot accept this, except if there's new data coming to light. And that's why SAHPRA approved it, or didn't approve it, but said that if they will remain open, if there's any new relevant safety data that comes in, and they normally call this a rolling application. But so far nothing that we have, that I am aware of, that SAHPRA received to prove that this data is, that there's more safety on this data.
Dr. Coetzee, perhaps you can unpack for us what the actual dangers that have been found problematic with the Sputnik vaccine. We know that it is a 2-shot vaccine, similar to Pfizer. We know that the SAHPRA didn't find necessarily anything wrong with the first shot, but that it did with the second shot. Please, can you unpack this for us?
So if you look at the Sputnik data, they have, it combines 2 separate adenovirus vectors, where you have your Pfizer vaccine that is only mRNA, and you have your Johnson & Johnson that is DNA, adenovirus vector. This substrate that this specific vaccine uses is what we call an AD5 and an AD26. As a delivery vehicle. And the problem lies in the AD5. And this is not a vaccine that is new, or this vector, these adeno5 vectors, has been used in a study already in 2007. And that study has been stopped. The trial, they called it the STEP trial, and that was stopped in September 2007 due to the lack of efficacy. And then they used it, Sputnik Labs then used this again, this adeno5 in their Sputnik vaccine as to help to vaccinate. But we also knew during that time that uncircumcised men had already high pre-existing antibodies to AD5, and as I've said, this was in 2007 already. So this is a problem going forward. We cannot use that in South Africa.
Now, Dr. Coetzee, obviously this case applies strictly to South Africa. I mean, that's what SAHPRA had to consider here. But help us understand, now that this information has come to light, what options do other countries, like in Africa, have regarding Sputnik? Because we know even our neighboring country, Zimbabwe, has been using Sputnik. Of course, further afield, we know that Brazil and and India have used this similar vaccine.
So from SAHPRA side, our advice to them would be to go and look at the data. They have now started to use this vaccine in other countries, as you correctly mentioned, to go and again look at the new data, among their HIV population, especially the men, and see whether they can pick up any of these problems that has been seen during the STEP and Pombilli trials that has been done. It's always good to have an organization like SAHPRA, who is doing their due diligence and making sure that whatever comes into the country would be all beneficial to the country. That would be our advice to other countries.
Dr. Coetzee, as we wrap the interview, tomorrow, as you know, South Africa is set to commence with the vaccination for children aged 12 and 17, or aged between 12 and 17. Now, a lot of parents, even though those that have been vaccinated themselves, are still finding it very difficult, to vaccinate their own children. Talk to us about some of these concerns when it comes to safety of vaccinating children, in particular, with these COVID-19 related vaccinations.
Look, it is everyone's right to be vaccinated or not, whether they want to or not. But mainly these vaccinations from the age group of 12 is there to try to protect and help and assist those children who is suffering from chronic diseases, immune-compromised diseases, kidney failure, all of that. You try to get those children to stay safe. So if they, for argument's sake, do get COVID-19 disease, their chances to have severe disease are highly elevated. That's the one thing. The second thing is these children, the death rate might increase under these children. Again, we are talking about children who need this vaccine. For those children, it becomes difficult to say, don't take it. I would like to also show or to make mention of the fact that we know that COVID-19 is a severe disease, and we have even seen on the mild diseases now during especially the third wave, that one of the complications were myocarditis.
Yeah.
And so, again, we know that the vaccine itself also have that as a warning that you can get myocarditis from that. But if you look at the numbers, it's extremely, extremely low.
Fantastic. Dr. Coetzee, sorry, we have to stop this interview right now. We've run out of time, but thank you so much for your analysis and for your time this afternoon. Of course, they're saying that the risks are actually far lower than the benefits of having your children vaccinated as of tomorrow.